Hello, my name is Norina Gasteiger, and I'm supervised by Professor Dawn Dowding, Dr. Sabine van der Veer, and Paul Wilson. My PhD project is entitled Virtual and Augmented Reality for Upskilling Care Home Workers in Hand Hygiene Practices, a Realist Evaluation. So we know that infectious disease outbreaks can have devastating effects on care home residents. Last year, the NHS released a policy promoting hand hygiene in care home settings, as adherence continues to be suboptimal, but is crucial for preventing the transmission of infectious diseases like COVID-19. Virtual reality, VR, and augmented reality, AR, have been identified as new tools to potentially promote hand hygiene in health and care workers by correcting practice with feedback, raising awareness, and building muscle memory. In virtual reality, users become immersed in a digital environment, whereas in augmented reality, real-world environments are complemented with computer-generated imagery or objects. Previous uses of VR and AR training have been promising, but are limited for care home workers. A gap in knowledge also remains on what makes AR and VR training effective, for whom, and in which contexts. My two research questions are therefore, how and under what circumstances can VR and AR smartphone apps be implemented to upskill care home workers in hand hygiene practices, and how and under what circumstances do they work? There are four main components to my PhD program, starting with a systematic review of existing hand hygiene apps, which I have completed. The purpose of this was to assess the content, technical and functional features, and quality. It was also important to identify any apps that used AR and VR and are available in the UK. The second component is a realist review, which I've also completed, and the purpose of this was to form an evidence-informed program theory on how AR and VR have previously been used to upskill health or care workers by considering contexts, mechanisms, and outcomes. We also tested and refined the theory by using empirical evidence from 7 databases. The third component is the one which I'm currently working on, and this is a realist interview study with care home workers. And the purpose of this is to explore the care home context, refine the program theory, identify mechanisms to be tested, and also determine which app might be appropriate to use in the future. In my future component 4, I will likely conduct a pilot experimental study, but the methods depend on my findings from my current interview study. So this will help us to test the program theory and determine the effectiveness and or feasibility of using VR and AR smartphone apps for promoting hand hygiene in care home workers. I can share some results to date. So we identified 90 hand hygiene apps and reviewed them. We found that only 68% of these met the minimum acceptability score of a 3 out of 5 by using the validated mobile app rating scale, and 42% used innovative approaches to engagement, of which 4 used AR or VR. You can read the full-length paper in JAMA, which has already been published, and you can scan one of the QR codes at the bottom of my poster to access it directly. For the realist review, we identified 80 papers on VR and AR training and used this to form a program theory. We then tested it by using empirical evidence from 46 studies. We found that mechanisms were perceptions of realism, easier visualization of patient anatomy, interactivity, deep immersion, and repeated practice within a safe learning environment away from patient harm. Outcomes included improved skills, learning and knowledge, and learner satisfaction. And barriers and facilitators to implementation and maintenance involved technology costs, attitudes and negative experiences like cyber sickness, logistics, access to training, and leadership and collaboration. The protocol for my realist review can be read in BMJ Open by scanning the other QR code, and the full-length review will hopefully be published soon, as it's currently under consideration by JMIA Serious Games. In the last year, I've also completed lots of training, including on strategic publishing, journal reviewing, academic writing, conducting realist reviews, and completing an ethics application. In the future, I will continue to explore the care home context and test and refine the theory. I've also been enrolled in some statistics and project management training. And ultimately, we hope that this work may help to develop an innovative and engaging approach to hand hygiene training. It will also help to determine how AR and VR training works, for whom and in which contexts. It will also identify considerations for implementing and maintaining AR and VR training and hand hygiene interventions, and hopefully provide a blueprint for other researchers who might be interested in conducting realist evaluations. Thanks for listening.